Have you ever considered that the way you breathe could be affecting your overall health? From sleep quality to jaw development, airway health plays a crucial role in our well-being, and yet it's often overlooked in traditional dentistry. Today, my guest is Dr. Kalli Hale, and she is on a mission to change that. As an airway-centered dentist and the founder of Toothpillow, Dr. Hale is passionate about helping both children and adults identify and address airway issues that impact their sleep, their health, and their breathing. As an airway-centered dentist and the founder of Toothpillow, Dr. Hale is passionate about helping both children and adults identify and address airway issues that impact their sleep, breathing, and overall health. She's also a clinical advocate for VIVOS Therapeutics, where she works to educate and train other dental professionals on the importance of airway-focused care. If you've ever wondered whether your breathing patterns or your child's dental development could be affecting more than just their smile, this episode is for you. We're diving into the signs of sleep disordered breathing, why airway health is the missing piece in many health diagnoses, and how Dr. Hale's innovative approach is changing lives. Let's get into the episode. Welcome to the Trust Issues Podcast, the show where we question everything society tells us about how to live, work, eat, and be. I'm Erica Auckland, a mom, entrepreneur, and advocate for living life on your own terms. Here we challenge the status quo, from the food we feed our families to the way that we build wealth and well-being. You'll hear unfiltered conversations with everyone from farmers, financial experts, and everyday people who are doing life differently, all with one goal: to help you live healthier, freer, and more abundant. If you've ever felt like there's more to life than following the crowd, you're in the right place. Let's get into it. Dr. Kalli Hale, welcome to the Trust Issues Podcast.
Oh, thank you so much for having me. This is going to be excellent.
I can already feel that, like 100%. So I want to dive right into it. And I'd love for you to explain, what is airway-centered dentistry and why is it such a game changer for overall health?
Oh, I would love to. So yeah, I mean, I get questions a lot in my DMs of just like, how is airway dentistry different than general dentistry? Like, I'm going to my dentist, are they not looking for the same thing? And I have to just remind people that it is a completely different set of training. Unfortunately, sleep apnea, sleep disordered breathing, and therefore airway dentistry is not taught in dental school. There are some that are starting to pick it up, which I'm like, yes, please teach this, especially when it comes to the parts about our kids and our babies' growth and development. But it's just not mainstream. And the education after dental school, after you've already spent hundreds of thousands of dollars a year in debt, is also really expensive. So it's not, unfortunately, mainstream enough that like no matter what dentist you're going to, you're going to be screened properly, unfortunately. So there is a big difference, and we focus on, of course, do you have cavities? How's your gums and your teeth? Like, we still love all of that, but we're going to be paying attention to how is your sleep? How is your child developing? Do they have any sleep issues that maybe you're thinking are normal, which might just be common? And are they going to have enough room for all of their teeth? So that's a really important differentiator between really what we look at in a traditional sense versus an airway sense.
I love following your Instagram because I find that, and we'll get into everything that Toothpillow does, and I just am so fascinated about Toothpillow in general, but I find that your Instagram account is so educational. It's so helpful. Like, a couple things that I just want to call out. So if you're listening to this and you don't follow Toothpillow, go to @Toothpillow_official on Instagram. And I'm just reading from a couple posts on the page. And one thing that is actually a pinned post right now, currently at the time of this recording, it says braces work until they don't. And I think this is such a fascinating thing because, like you said, I am someone who, now I have kids, but before I had kids, I'm someone who was, I had braces twice. I had a tooth removed. Same. I had so many issues with my teeth. And I still to this day, like my teeth aren't exactly where I want them to be. I'm still like, what is the next step for me? So I find that so many people think like, okay, well, in order to have, a beautiful smile, I have to go get braces. But what you're saying is basically like airway dentistry and traditional, maybe orthodontics, like they're not really like looking at the same thing.
They're not in sync.
About that.
Yeah, they're not. So braces in the general sense are a cosmetic fix, an alignment issue. Your teeth are crowded. I have the same story as you. I had braces twice, once as a preteen, and they put headgear on me the wrong way. And my teeth honestly weren't even straight the day I got my braces off when I was 14. It was rather heartbreaking because they were on for like years. As you know, braces is not fast, right? And they wanted to pull my teeth, but my parents, who are also dentists, said
Amazing.
no. But they don't do it. My parents didn't do any airway or orthodontics back then at all. So they just said no, but they didn't really have like a strong reason behind it. Just like, nope, we just want her to keep whatever she has, do your best, whatever, which was not his best. I'm like looking back at my old models of my teeth. I'm like, I could have fixed this. I knew exactly what they should have done.
That's
So when I was in
crazy.
dental school, I was like, I want to have white, beautiful, straight teeth. Like I'm a dentist, I should have like a beautiful smile. And so I went back into, unfortunately, traditional braces with a resident there who was, great for all intents and purposes, but they told me, you don't have enough room in your mouth for your teeth. And they sanded in between all of my teeth. Like it's like sandpaper that we use. And that's called IPR, or interproximal reduction. And they do that in order to like have room to squeeze the teeth into better alignment. But nothing was done like I do, with expansion in mind, where you don't have to cut down your enamel for the sake of straight teeth. So
Wow.
I didn't know any different. I was a second year dental school student. What would I know? So I do that. My teeth are straight, whatever. Then I get out of school. I start learning about all of this. I'm like completely mind blown because I went to a very prestigious university in Texas. And I'm like, how did we not learn about this? This is wild. And when I learned the pediatric part of sleep disorder breathing in dentistry, I was literally floored. I was like actually kind of mad because how did I not learn this? And the number of patients that I told, your snoring's normal and they'll grow out of it, for the kid, like the
Oh my
mom was
gosh.
like, hey, they're kind of snoring. And I was taught in dental school to tell them, like, oh, don't worry, they'll grow out of it, which there's like literally no research to support that. Okay. So I'm like, this is crazy town. Like, I'm just repeating what I learned, And then when I learned all the things that I've learned now, I have not stopped. I'm like a freight train of, you need to get your kid out of braces and into growth and development tools, myofunctional therapy, expanders, like the whole thing, before they're ever just straightening the teeth. So I always say foundation first, foundation being your jaws, teeth second.
So good. Okay. I mean, I just like want to talk. I'm like so nerding out about all of this because
Yeah,
obviously being the adult that went through it myself and then now being a mom, but I want to talk
same.
specifically about Toothpillow. So your
Yeah,
company Toothpillow has a very unique mission. Can you share a little bit
yes.
about what inspired you to start it, how it's helping patients today?
Yeah, so I own a group of practices in Texas called the Airway Dentist. Okay. But prior to that, I was just me in one single office, seeing patients and having months long wait lists. Okay. And I was offering tooth pillows in my practice, expanders, clear aligners, all the thing. And literally, what I was seeing coming out of these tooth pillows was absolutely wild. Also, that's not even a technical term for the appliance. I called it a tooth pillow years ago, before tooth pillow was even like the virtual company was even a seed in my
That's
mind.
crazy.
I just thought, this mouth guard looking thing, that mouth guard's like a gross, like I don't like that word. Like, we need something cute and fun for the kids. And so I would tell them it's a pillow for your teeth, which it literally is. And it was creating such room for their teeth. Teeth were being straightened in a way that people did not believe me. They thought I did braces on these kids. And the changes between ages like 3 and 12 are just absolutely insane. Like, absolutely insane. And the president and the CEO of Toothpillow are dear friends of mine, and they were part of an organization that I was speaking for a lot because I was teaching this stuff after I fell in love with it. I was like, everybody needs to know this. Like, if you're a dentist, I really don't care if you do it, but you need to know about it so that you can tell the mom like the right information, like where to go. And we sat down and we had, with the founders of this company years ago, on late night Zoom calls, just ideating on how can we extend me, because I can only see so many patients in a day, and patients fly still out of state to see me.
Wow.
It's like absolutely crazy. They will drive hours and hours and hours and hours because they just know that my approach is going to be whatever is best for your kid. Like, whatever we have to do, like, I'm going to figure it out. That's just my personality. Like, I never thought I would help a child stop bedwetting. Like, I'm a dentist. I work up here, but like,
That's
bedwetting
crazy.
is a sign of sleep apnea, sleep disorder breathing in kids. And we have it stop when they're in a tooth pillow. So I'm like, all of a sudden people are just like flocking, right? And there's only a handful I would say not enough doctors in the country that are trained in this. So, and we all kind of know each other and we would message, and I'm like, guys, what we're doing is like unbelievable, and the world needs to know about it, because the narrative is you wait till you're a preteen or a teen to do braces. That's the narrative. Like, you wait till the baby teeth fall out. Why would we spend any money? I hate that question like so much. Why would we spend any money while they're still baby teeth? And I'm like, because I don't care about the teeth. This isn't even about the teeth. This is about their jaw development. Like, and I just like get in there with the dads. Let me tell you, I really do. I'm like, you like just need to understand like what we're doing. And we just decided that we had to build a virtual dental office in the sky that would allow us to bring this literally life-giving treatment to families all over the United States, straight to their doorstep, because you can't drive 6 hours, or most people can't afford to just fly to see me. That's just like unrealistic. And the number of children that are suffering from this is not even something I can take on all by myself. And so then spawned Toothpillow, which I'm so glad we named it that. We were back and forth for so long about like what to name the
It's
company.
perfect.
And thank you so much.
I love it. I
And
think it's
it's just
perfect.
been crazy. Yeah, well, I appreciate that, because I was like, guys, we just have to. You had to believe me. We got to name it Toothpillow. And we've helped now over 5,000 children. And it is just like, it brings tears to my eyes when we're screening these kids, because they're suffering so badly. These moms need somewhere to go and somewhere that they're going
Yeah.
to get answers from somebody that they don't have access to. And then to see them post pictures before and after of how their kids' faces are changing and their jaws are changing and they're sleeping again. It's just like, it's really, I think, what I was put on the earth to do. So,
I mean, as a mom of a 3-year-old who now can get a consultation, and we've talked
yes.
about that, my husband and I getting a consultation for a tooth pillow for my son because he's got a couple things that are red flags, which I want you to talk about because I think they're so normalized, you know? And so, like, as a mom who has been down that road of like seeing a traditional dentist, you know, having people kind of like dismiss it or just kind of say, like, oh, those things like mouth breathing, almost like it's funny too. I find that a lot of people will see babies mouth breathe and they're like, oh, how cute. Like, and I'm like, no, knowing what I know. So
Good
I'd love
job.
for you. I'm like, oh my
Yeah.
gosh. So I would love for you to talk about what are some of the most common signs and symptoms of this sleep disordered breathing that people are probably overlooking.
Yeah. I like top five. Mouth breathing's at the top of the list, absolutely at the top of the list. If you, and what I just need people to understand is that your tongue is your natural palate expander. Okay.
Mm.
And if your mouth is open, your tongue is low. If your tongue is up, your mouth is closed. Okay. So when their mouths are closed and they're breathing through their nose, we know that there's pressure being put up at the roof of the mouth, which is going to help their jaws to develop, which just doesn't happen commonly anymore because kids have allergies and issues and swollen tonsils, adenoids, or whatever. So mouth breathing, top of the list. Snoring, never normal, never okay, never cute. And I've heard all of those things from parents. I think it's just kind of cute. He snores like his dad. So I'm like, well, your dad and your husband and this baby need to be seen because it's never normal for any age to snore. So
So good.
that's another one. But probably I would say one of the most common that parents will come in and tell me about is tooth grinding. So they'll tell me that like they can hear their kid grinding their teeth through the walls. And I'm like, or from their room to wherever. And I'm like, oh my gosh. And then I've seen kids, I look at their teeth and they've like worn down the enamel. They're into the yellow part, which is the dentin. And I'm like, this is serious. Like, this is not just, oh, maybe they do it every once in a while. But also some parents, just as their kids get older, they're not sleeping with them anymore. So they don't really know, they're like, I don't know. Can you tell me if they're sleeping okay? And I'm like, yeah, I can look at their mouth and tell you, which is why in the tooth pillow process, we have them submit all these photos of their kids' teeth, because I don't need much to be able to tell them that they
Wow.
need a tooth pillow. Like I can be anywhere on an airplane looking around going, oh my gosh, like all these poor kids, like it's just the way they're developing. So I think that was number 4. I don't know, mouth breathing, snoring, tooth grinding, ADHD and hyperactivity. So I'm really active. I've written some articles about the ADHD discussion, the ODD discussion. The oppositional defiant disorder is probably a little less well known versus like the common term of ADHD that we've all heard about for decades. And that warrants a sleep study, like every single time. I tell parents, like, if your child is being told that, or they're telling you, maybe there's some hyperactivity, some attention issues, anger, stuff like that, that's just like wearing so badly on these families. Like, I've treated the most of severe kids, and when you get a child that has oppositional defiant disorder sleeping through the night, and by sleeping through the night, I mean actually breathing properly. Okay. They might sleep 12 hours, but if that quality's not good, then they're not going to sleep well. But those kids won't even make eye contact with me when they come to the appointment. Like they are just like ghosts. They're angry, they're mad, they don't want to be there. And I can literally look at the mom in the eyes and say, 6 months from now, we're going to have a different child. If you do what I'm telling you to do, your baby is going to be different and going to be making eye contact with you. And me and the staff. And last week, one literally came in and she slipped me a little, card. I never get presents as a dentist, really, and she just like, I have something for you. And I was like, oh my gosh, thank you. But I was really busy. I was running around, and I read it later, and she was just like, nobody would listen to us. Everybody wanted to be put on medications. You've given me my child back. And there's just nothing I could do to ever thank you for that. And that's why I do this, because I haven't met, I'm a mom. I have 3 kids. Like, I would do anything for them. I will drive wherever to get them help. And we needed to make sure that that help was literally at a click of a keyboard for Toothpillow. So any sort of neurological hyperactivity, oppositional defiant stuff, that is like, you need a sleep study, or you need an evaluation by an airway dentist to make sure that your growth and development is on track. Wow. And the last would probably be bedwetting, because that's a hush-hush topic. It's not one that parents are necessarily go to the dentist. You don't think to tell the dentist your kid's bedwetting, but you should tell your dentist that. And if they don't know anything, then find another one that does. Go to toothpillow.com, because it is a huge sign of sleep apnea. And the literature does show that with our appliances, it improves bedwetting significantly. Like 90% within 8 weeks will reduce their bedwetting episodes, because you get them breathing again properly and sleeping properly. So those are my top 5. I could list more, but those are probably the top 5.
No, and it's so good, because I think it's like a manual for a mom to like be like, oh, check, oh, I need to get my kid looked at. Because again, like I said, a lot of people just think, oh, that's cute, like they're snoring, they're mouth breathing. And to my knowledge, with what I have, when I follow Toothpillow, I am aware of some of these things, that there's a very critical window of growth and development with kids. Is that true? That like earlier the better, like making sure that you kind of tackle it earlier, because like you're saying, like so many times, like, oh, later they'll just get braces and we'll just fix it all later. And you're saying no, like there's
oh my gosh,
right? So can you talk about that?
Yeah, the later, so a child's head neck development, their jaw development is 94% complete, a girl at 12, which they didn't put braces on me till like 12 or 13. Okay, so they waited till all of this was like solid and done growing, and then slapped braces on to try to move teeth within this insufficient arch, which I have subsequently done expansion on myself. That's why it looks a lot better than it used to. I also was severely tongue-tied, so I forgot to mention tongue ties, but I was severely tongue-tied until 2 years ago. So I had to do all this stuff to widen my arches and then get the tongue tie fixed. And anyways, I've done that. I've been there. I've done that. And I really want to prevent people from having to do that when they're as old as me. Like, we should be doing it with their babies. But by 2 years old, they are half developed, 55% developed by 2. So a lot of people are asking us, because you can't submit for Toothpillow until you're 3. What do we do from 0 to 3? That's like so critical. And so we are working very tirelessly behind the scenes to have an incredible baby box. I probably shouldn't even be saying it right now, but I'm too excited about it. And eventually we will have an incredible product for new mamas to do the best that they can, getting them up until an age that, if they still need one, we're there to pick up the piece, pick up and help at 3. So, but yeah, the window is narrow, and waiting until you're grown and you're a teen to have braces is not correcting the underlying dysfunction. And the muscles, the tongue, and the jaw development are key. And it's, it always becomes this conversation of like, well, if I pay for this, am I also going to pay for braces? Maybe. But I can promise you're going to pay for braces, and you're going to pay for a lot of other health issues if you don't do this first phase correctly. So I'm just really big on phase 1 has to be done right. And we have not been doing phase 1 well. We haven't been doing it enough, for one, but there's also been a lot of muscle dysfunction and tongue issues ignored in the last 50 years. And that's what we're hoping to change the narrative of. Because if we can get on Instagram and push it to you guys so y'all know what to look for and what to ask, you are going to find the right provider for yourself.
What about the mom who is like, okay, my kid is 3, 4, like how the heck am I going to get my kid to wear this appliance, or like put this in their mouth and then sleep with it? I find that a lot of moms say that. I've seen that on social media too. Like, I just don't know. Like, maybe we just have to wait till later, until that they're old enough that they can actually follow instruction. What do you say to that?
Yeah. It's one of my favorite questions because we tend to put our own bias on, like, we wear a night guard or we wear a retainer or something. And we just assume that a 3-year-old can't do it. And they're actually like some of the best patients, just for the record. Like the 8 and 9-year-olds that are a little bit more defiant, they do great. But like I would be more worried about your preteen than I would your 3-year-old, just to be quite frank. My son started at age 3 because his tonsils and adenoids were really swollen. And I did not want him to have them out. I really didn't. And I knew that if I could get him in a Toothpillow early enough and we got him breathing through his nose, that they would shrink naturally. And they did. Now, it took him probably 5, 6 months till he woke up with it in his mouth. And he was like so excited because I would like reward, we have sticker charts, we have all this fun stuff. So it's like when you
Nice.
wake up and it's still in, it's going to be a party, right? So you just, my biggest thing is that this is such a life-giving appliance and treatment that to assume that they won't really makes me nervous because what's going to happen? Like they're going to be 8 or 9 and now it's a lot harder treatment perhaps. Like they need more than they would have, or they're going to suffer behaviorally or sleep-wise for all those years. And so I literally tell parents, like, I know it's expensive and you've got to think about it, and like you're worried that they won't use it, but you have to let them try.
Hmm.
And that is like my ultimate request for them at the end of these appointments is don't put your own bias in it. You have to trust it because if this didn't work, we wouldn't do it. If it didn't work on age 3, we wouldn't offer it for age 3. And it might be tricky. You might have to figure out what motivates your child. For my daughter, it was like a trip to the store, like wear it all week. We're going to go get a Barbie or whatever. And let me tell you, she's going to do it. And it's a lot easier than you think, but we have to let them try.
That's so good. You touched a little bit on like some of the long-term effects of mouth breathing, of not addressing the issues, these long-term health issues. We hear about sleep apnea. We're like, is mouth breathing really that bad? And I'd love for you to really talk about like what are some of the long-term effects, of being an adult and having these things that you've never addressed.
So sleep apnea is deadly. Okay. And I hate to just go nuclear with this because I have some other things to add. But the worst possible side effect of sleep apnea is a heart attack and death. And we see it all the time. The next time you hear of somebody tragically dying in their sleep at 55 and nobody knows why, I have some suspicions myself. So, but besides just going full blown to that, there are a tremendous amount of health issues that we deal with in America, cardiovascular disease being at the top, okay, that are affected by lack of oxygen and poor sleep. So I look at it as like the number one thing that we should be correcting in our patients to lower their blood pressure. Hypertension is a huge problem with patients with sleep apnea. And I personally have taken adult patients, monitored them over years once they've gotten into some sort of oral appliance or even a CPAP that have sleep apnea. And we have literally eliminated their high blood pressure. Like they get off blood pressure medication because they don't know why they got high blood pressure in the first place, but they had sleep apnea and they had oxygen issues. And as soon as they have oxygen, their body rests. The trick is if you're listening to this and you have hypertension or your husband does, your dad or mom, whatever, take their blood pressure in the morning. They should take it when they first wake up. It should not be high when they wake up. And if it's high when they wake up, they probably have sleep apnea.
Wow.
Because you just woke up, right? You're resting, right? Your blood pressure should be fine, right? But when it's not, you've been fighting for your life all night. So, yeah, go ahead.
No, I'm like my mind is blown because yeah, I think the issue is so many people underplay it. And you're like, "No, this is serious." What are some of the other health? I mean, cardiovascular, the fact that it's like,
Weight gain,
okay, talk about
your
that.
insulin and blood glucose dysregulation is absolutely huge when you have sleep apnea. So every time, so what does sleep apnea mean? You stop breathing, okay? You literally stop breathing in your sleep and then you start breathing, hopefully again, okay? Over and over and over all night long. You will stop breathing and start breathing and stop breathing and start breathing. So your heart is just constantly like working overload because your heart has to pump blood and oxygen to the rest of the body. But every time you stop breathing, you go into fight or flight mode, okay? Which is really great for our inflammation and our cortisol levels,
Oh
right?
my
Really
gosh.
good. We're just all so healthy when we stop breathing. So when your cortisol spikes, so does your insulin. And now you can gain weight in your sleep when you're not even eating. It's great. So we will get till our 30s and 40s and we will have this unwanted belly fat. We don't know why. And our, if you wear like a continuous glucose monitor for fun, just to see like, how's your blood sugar doing? You will see it spike at night, like in the middle of the night. So yeah, heart disease, bad stuff, hypertension. I'm like, there's just so many things. And, insulin resistance, blood glucose dysregulation are really, really huge ones.
What about mouth tape? I mean, mouth tape is so viral right now. It's all over social. If you go on TikTok shop, there's like
Yes.
30 different mouth tapes that are, going viral or whatever. So what's your
Yeah.
take on mouth tape?
So I love lip taping, mouth taping. If you haven't tried it and you don't have sleep apnea, strongly 10 out of 10 recommend. You will just be like unbelievable, like how well you sleep when you force yourself to breathe through your nose. My doctor mind, though, kicks in because I have had patients. I had a guy, and no kidding, 2 weeks ago who said, I lip taped and I woke up on the floor gasping for air. He woke up and he's on the side of his bed on the floor, and because he had desaturated so badly, he needed to be able to breathe through his mouth, okay? Because he had never had a sleep study before. So my caveat is please make sure you've had a sleep test, like a home one, find an airway dentist, just something before you tape your mouth. Now they have some that are ventilated, so that's at least a little bit. This guy was like full on, like taped it shut, like because he was snoring so bad, and his wife was really frustrated that he was snoring. And I get it. Like, we're just trying to find quick, easy fixes for snoring. But a lot of the time, snoring is a lot bigger deal than people think.
Wow. I'm like imagining that wake up, I mean, I lip tape at
I mean,
night.
he
I
could have
love
died.
to lip
He
tape.
literally could have
Yeah,
died. Like,
that's crazy. And it's like, hey, everyone just buy this lip tape. Also, by the way, it was possible side effect. So obviously your product is, Toothpillow, which I want to talk specifically about, like, okay, Toothpillow, what is like a treatment plan that you would suggest to a potential, like a candidate that's a good candidate for the product for Toothpillow? And like, what's like the journey look like? Is it like a 3-month process? Is it a 6-month process? Is it a year? Is it probably different for every patient? But I'd love for you to talk
sure.
about specifically how you would look at a patient and say, because you work with children, this is a good candidate and this is what a treatment plan is going to look like. And then
Yeah.
how that ends up for them. And because like you said, you've worked with
So
how
the
many,
patient,
5,000 children?
oh yeah, so many now. I
So
mean,
yeah,
we've
I'd love to hear that.
screened, I think we're about to surpass the 20,000 mark in screenings. So it's like
Wow.
absolutely crazy what this life is for me right now. Cause I'm like, anyways,
Amazing.
so the patient journey, they'll hear about us. It's all basically word of mouth. So maybe an influencer on Instagram or a friend or a family member, and they'll go to the website. It all starts there. And we have spent hours and so much money building a website to really tell a story about why you should care about tooth, like for your kid, right? Like, do you actually need it? Maybe your kid doesn't have all the signs and symptoms, which is great, but there are orthodontic things that we can identify to tell you yes or no. So you get on our website, and I always tell people, make sure it's at a time where your child is with you because you need to submit photos for us. And you will fill out our questionnaire, medical history, a sleep questionnaire, and you'll give us as many good pictures as you can of your child and their bite and their teeth. And that will be reviewed by either myself or our the other chief dental officer, Dr. Ben Moralia. Okay. And he is just, I'm his biggest fan. He taught me so much in my life. And I'm so excited that he's a founder with us and had started Toothpillow. So that will get reviewed by us before it is ever sent to the state level treating provider. So we have providers in all of these states to help the parents and the patients and get the kid the treatment that they need. And also, if you have to be denied because you're too severe or your child is too old and we know that they need custom expanders, we need a doctor that we can send you to in office, because like I alluded to earlier, you can't just go to the guy on the corner. They're probably not going to have any idea what we're talking about, and it needs to be done right. So
Yeah.
you'll submit all of that, and then you have the option to select whether or not you want to purchase a customized video from that dentist. Okay. You don't have to have a video in order to start treatment, but if you really want to know what this is about and what we see in your child, that dentist will do a Zoom recorded video, literally showing you exactly what they see on your child's photos, like they would if they were in office. So we wanted to try to mimic exactly what you guys would hear and see based on what we could tell from photos. So that will get sent to you. And then at that point, you can choose whether you want to start the treatment or not. And you will be sent a beautiful box from Toothpillow that has the child's appliance in it and some really other fun stuff just to get kicked off in their treatment. And the treatment is 24 months. So we price it based on 24 months of access to your dentist and everything that would happen in between that you would need. If they've sized up and they got more new teeth and they need a different size tooth pillow, then that will be included in their 24-month treatment.
So good. And obviously, Tooth Pillow is for kids. So starting from 3 to what age?
12.
12. What about adults? Are you
I
guys,
know.
does Tooth Pillow have plans to help all the adults who are mouth breathing in the world?
Oh boy, do we. I mean, that is a little trickier because once you're an adult and you're done growing, the treatment and the stuff we have to worry about with your jaw really has to be done in office. And so we have obviously partnered with many dental offices around the United States just to have doctors that are working with us anyway. So it does say coming soon on the website. We are always working tirelessly behind the scenes to figure out how quickly we can kick this off. But for now, we just will help you find somebody that I have personally vetted or Dr. Moralia has personally vetted that we love and trust to say, go get a consult from them. They do things the way we do. So if you're in the Houston area, obviously you can come to one of my offices. I have incredible dentists at many locations around the greater Houston area, but we will help you find somebody. It may be a drive. I warn you, it may be a drive, but if you need it, it's worth it.
You mentioned that there's some misconceptions around Toothpillow, and I think this would be a great chance to kind of set them straight because, I think in the health and wellness space specifically, there's so many gimmicky things that come up or people are talking about, influencers are talking about this thing and that thing, and it's money that parents really see. I think it's dollar signs, like more money that I need to spend for my kids to be healthy. Right. And I think that really discourages a lot of parents, but I'd love for you to set the record straight a little bit around Toothpillow and maybe some of the misconceptions that are flying around.
Yeah, so there's not a ton, but there's enough that I have like the Mythbusters part of this, right? To clarify. So I think one of the first things, one of the biggest things, especially for dentists and doctors that get on and want to have commentary and they don't really know the company and the heart and the mission, is that every child is approved. They think this is just like a click and buy, like you can just have it. It is legally doctor driven. Like it has to go through the doctor. So you have to submit your child's medical history and their photos and all of their information. That has to be reviewed by the doctor. The doctor has to approve the care, the size, the appliance type, like whatever it is, because they're not all the same, and then have it sent to the patient. So one of the big things at first was people literally, one time I was told that I was Amazon. I was like, oh, I wish. Not really though. Like we are not Amazon. You cannot just click and buy. Like this is, we've had to build something that would be supportive to families and truly what they would be getting is if they were in office, if they're approved. So that's one of the big ones is a lot of direct to consumer products are not limited, right? Like you can just go get it and you can try it. And that's just not how it works when it's actually like a doctor driven company. So that was one of the big ones. Go ahead.
No, go. I'm loving this. Yeah.
Another was, so we offer myofunctional therapy we have actually a board of directors of myofunctional therapy. So it's extra, it's not included. All this stuff is expensive, but like your myofunctional therapy is a critical muscle exercising component for tongue placement. Everybody knows about mewing on TikTok. So just think mewing, but with a professional that's training you and getting your child ready to see an in-person provider if I needed to fix their tongue tie, for example.
What is mewing for anyone what's mewing for someone who doesn't know what that is?
So we actually have a really funny reel of me on the Toothpillow Instagram doing this whole thing.
We'll find it.
But basically you put your tongue to the roof of the mouth and you're putting pressure, and you see how it tightens all this and it gives you that snatched jawline. Yeah, there's a really funny reel of me using Gen Z and Gen Alpha terms, which is just not my, I was like, what am I saying? I learned it anyways. So, but myofunctional therapy is very patient specific. You are going to be given certain tongue exercises or whatever, by live over Zoom by a provider. This is not recorded stuff. Now we give breathing exercises. Of course, we're going to give you automatically in your Toothpillow experience anything we can give you to help, like, because not everybody can pay
Mm.
for absolutely everything. But there was this huge misconception that we were offering like one size fits all Mayo, and people just had no idea. I'm like, just ask me, like literally just DM me if you think you know something about my company, because you probably don't. And I do this for a living in real life, like all the time. So I know what I'm doing. And like, we're doing our best to try to treat the masses here. You know, nobody's ever done this before. So myofunctional therapy is definitely like patient specific driven and led by a myofunctional therapist. And they thought that was like a one size fits all, you know, freebie myo. So those are probably the two main ones, unless you've heard any other ones that I
No,
could
that's like what
clarify.
I've heard. No, that's what I've heard, honestly, as a mom who has taken my child to myofunctional therapy, if I'm saying
Oh,
it correctly.
awesome.
I've done that.
Yes.
And I didn't, I mean, to be honest, like I didn't really see a ton of results. It was really challenging. I also would love to ask you about the Myo Munchie because that was something that we have for
Yes.
my toddler. But I'm imagining like this is one piece of the puzzle. You know, it's like
Yes.
obviously moving the mouth and the jaw, expanding it forward on top of the
Right.
therapy. It's like having that all in one place. I'm just like, this is
Yes.
genius because you know, when you're a mom and you have this appointment there and you have this over here, and then you're also maybe working, you have to make
It's a
dinner
lot.
tonight and all the things. It's a lot for a parent to worry about, oh, this is another thing we have to do. But when, you know, you work with Toothpillow, I'm like, wow, we're signing up for a consultation. Like I'm very
I can't
impressed by
wait.
that piece because I think it is one piece of the puzzle. I mean, obviously you're the expert, so you tell me.
Oh, no, you're absolutely right. And I think depending on how little your baby is, like I think you said three, right? Like just turned three. Myo would be kind of tricky at that age, you know? So I know we will definitely see babies that age, and our myofunctional therapists love to start that young. But it is a lot. It's a lot. All of it's a lot, especially if you've never heard of any of this before. Like you just see a
Yeah.
link and you're like putting it in and you're like, wait, what do I need to do? And it's $2,000 and like whatever, you know, you're just kind of like, it's like, what do I pick and what's going on? And I totally resonate with that. And I truly tell patients all the time, like you should be so informed of your decision before feeling like you have to go through with it. Like I want you to know exactly what the expectations are and what we need you to do. And we've put that in a beautiful package to try to make it as easy as possible for the families, but also to know that you should have patience and grace with yourself because it's not going to be instant. Maybe it's not maybe going to be overnight that they keep it in their mouth, but that the long game is so worth it. It is so worth it. So yeah, I appreciate you saying it's better if it's all just under one because we agree. And we knew that our success rate would not be at nearly as high as it was if we didn't have incredible myofunctional therapists on our team. So we just sought
Hmm.
out the best. We're like, hey, come on, join the movement. Let's do it.
No, that's so good. And I think also the fact that you could like meet with someone on Zoom, like not have to leave your house. I'm like, that's
Yes.
so good. And I think in the world that we live in today, sadly, you know, parents are just busier than ever and stressed and, you know, probably both parents working. And so that just really, really does help. I mean, I think for my listeners, I have had many people message me before when I was sharing that I was taking my toddler to a myofunctional therapist. And like, we live in like a health desert, you know, there's nothing around. Like,
Oh,
you know, I'd have
yeah.
to drive. And so just, you know, obviously, I think there's probably those moments where you do have to get in your car and make a trip. But that is a convenience that I think does meet the modern mom where she's at and is just so intentional. In terms of just you being this expert and, you know, having seen so many different types of children and patients with so many different types of mouths and jaws, I'm imagining, like, what are some other things that moms should know that would encourage them to take this step? Because, like you said, maybe someone's listening right now and they're like, I don't even know what all these terms are. What is a tooth pillow? What's myofunctional therapy? I would just love for you to just speak to that mom who feels like there's another thing I need to do and maybe encourage her, but also
Yeah.
share the importance of this.
I would really just say to pay attention to how your baby's doing. And we're always with our kids. We always know they're doing fine, right? But just pay attention to how they regulate. And are you dealing with a lot of tantrums? Do you feel like they're hard to wake up in the morning? Are you having more arguments than you'd like to admit, just in general? And of course, how the 3-year-old manifests sleep deprivation or sleep apnea is very different than the 12-year-old, you know? And so just along those lines of what have doctors told you before? Like, have you been told you need braces? I mean, if you're being told you need braces, you better find somebody that can give you an idea about their skeletal development first. because they're for sure going to sell you braces. They're going to do it. You got crowded teeth. Let's put on braces. But you will not know to ask about, well, what is the measurement of their palate? Nobody knows to ask that. And there is a
Wow.
minimum that it should be, right? Like, and you shouldn't have to know that as the consumer or the mom. You just shouldn't have to. But unfortunately, you got to ask now. And thanks to podcasts like yours, we can get the message out of like, just get another opinion before you spend any money. And before somebody tells you to wait until your kid is 12 or 13 to spend that money, get another opinion by somebody who's actually trained in pediatric growth and development. Because otherwise, you might be getting some real old information. Like I told parents for many years, their snoring is normal and they'll grow out of it. And you just don't, you can't trust everybody. You've got to get multiple opinions nowadays.
Wow. And I actually want to quickly ask you about the adenoid and tonsil thing, because I feel like so many people are having to get their children's adenoids and tonsils
Oh my gosh,
removed.
it's like left and right. Absolutely. Yeah. So when my son, I shared like earlier, I was like, I want to shrink your tonsils and adenoids. But how do you do that? And the way you do that is you fix the mouth breathing. So if
Mm.
you can get a child breathing through their nose's job is to warm, filter, and humidify the air. When we don't warm the air, filter the air, or humidify the air, it comes in through the mouth and it's very irritating to the tonsils. All that bacteria, everything that they're breathing in. And the tonsils will start to swell, the adenoids will start to swell, and it'll become like a little bit of mouth breathing turns into, I can't breathe through my nose. Oh, maybe I have allergies. Oh, maybe we need allergy shots. Like it's like the little things that you could pay attention to when they're 1.5, 2.5, 3.5 will tell you exactly how they're going to be when they're 6, 7, and 8.
Wow, that's mind blowing. Yeah. And I'm imagining, we have so many supplements out there that are for kids' gut health, and that is for, immune health. And I'm imagining if your child's mouth breathing all night long, what that's doing to the immune system and to the gut.
Bad things. Bad things, because you have to go back to the inflammation, the inflammatory markers, the fight or flight mode, and the things that are going to happen in their system when they have these apneas. So it's all connected. Your gut is literally responsible for whether or not you get tooth decay. Mouth breathing causes major tooth decay. When you eat food and your saliva goes into your stomach will communicate back with one of your major salivary glands, the parotid, and change the acidity of your saliva. So you have a sip of Coke. That Coke is so acidic, it will drop the pH of your mouth for 20 minutes. Mouth breathing will keep it so dry that you will get rampant decay. So these poor moms will come in and they're like, my 4-year-old has all these cavities. I swear I brushed their teeth. They're crying. They're so embarrassed. They can't believe it. Like, I'm like, hey, my 3-year-old that I was talking about, that mouth breathed and snored, got a cavity. The dentist's kid got a cavity. And I floss his teeth every single night. And it literally, I saw the cavity as I was flossing when a little piece of his tooth broke. Okay. And I'm like, this shows you exactly the power of mouth breathing and airway disorders in kids. So yeah, girl, it's a lot.
Wow.
Mm-hmm.
You are not only just like obviously changing lives out here, but you're like such a fun dentist. I'm like your
Oh, thank you.
energy. Like I'm imagining like, the crying moms who come into your office, and it's like you are so encouraging. And I just, for
Thank
anyone's
you.
listening, I hope you feel encouraged that like you said, your child,
They
you
should.
being the dentist, was dealing with these things. So, I think my
Absolutely.
last question for you, or one of my last questions, I might have one more after this, but one of my last questions I would want to know is like, why are our kids mouth breathing so much? Like, what is causing this? Is it, generationally that all of our faces are shrinking? Like, what's going on that this is becoming? Are we just paying attention to it more now? Like, is it a little bit of both?
It's a little bit of both, but we are like 7 or 8 generations screwed up at this point. Just to get a little less guilt on everybody, because what we see when Western diet kind of took over generations ago is a whole lot of health issues, like the processed foods, the underdeveloped jaws, the lack of breastfeeding for as long, and the whole
Mm,
formula push for moms, pacifiers, soft foods like squeeze in, which I used all those on my kids, the squeeze in your mouth packets, the dissolvable things because we're afraid they're going to choke. Like all of that changed the way our faces developed and affects us still today. So even if you breastfeed till they're 3 or 4 and like all this stuff, there is still a chance that generationally they're still going to need treatment with expanders or a tooth pillow. and it's not really your fault. You can blame it on your ancestors, I guess. But hard food diet is key for babies. So I know the founder of Baby Led Weaning, the author of that book. She's incredible. And I highly recommend baby led weaning for anybody that's trying to figure out how to introduce foods to their infant.
Mm-hmm. And like I will say, I think probably some of what my son is dealing with is probably generational. Hello, me. I've dealt with it. My husband also struggles with mouth breathing. He mouth tapes. Like we're a whole
Oh,
family
yeah.
that's like dealing with things right now. So this is a very like timely episode for us, but also just so many of the conversations that I have with people. And I did baby led weaning with my son, like we did a lot of
Good.
those things that,
Yeah.
we checked a lot of those boxes. So I think for the mom who's listening is like, I'm doing all the things like, hey, like you said,
Yes.
we're several generations deep here at this point. So getting
Right.
help and needing help doesn't make you a bad mom. It's just
Absolutely not.
knowing where to look for it, where to find it, finding the right type of help. I think is just like comforted me and given me kind of like, a little bit more of a permission slip to just not be so stressed about every single thing with my kid,
Yes. Oh, I
you know?
love that. That's good. That's good. That's such a good point. And we blame ourselves for everything. And we need to stop doing that collectively because we're all doing the best we can. And I think the more we can just band together, we're going to do better for our babies. So,
100%. Last question for you is if
okay.
someone's listening who wants to start doing one thing today to improve their airway health, what's one thing they could do?
Okay, adult or child? Which are we talking about?
Can we do both?
Okay. So, yes. Actually, okay, my answer will be a little bit different. The best way right now to start improving your child's health is by doing nasal sprays, nasal hygiene with saline. Start cleaning their nose and making sure that they have the best nasal breathing possible if you can't do anything else. For adults, I would actually recommend intake breathing strips. So, and mouth tape is great, but I can't just blanketly now recommend everybody tape. But the intake strips, I've been an affiliate with them for a while. They're incredible, you guys. Like they're like breathe right strips on crack. And I exercise in mine.
I'm
And
looking them
which
up
my
right
husband and
now.
I sleep. Oh my gosh, have you not seen that on TikTok Shop now?
No.
Because it's on TikTok too. And I was like, how do I get it on that? Like it was just crazy. It's so good. The videos are incredible. And they're these magnet strips that go over your nose and dilate it like this to help you breathe.
Wow.
OMG, they're so good. So y'all should definitely check out intake breathing.
Do you have a suggestion on a brand you like for nasal spray for kids?
So we use the X Clear spray, the Xlear spray.
Okay.
So that is saline and xylitol. And there are plenty of just like plain saline ones too. So, but in your tooth pillow box, you get X Clear. And it's great because it helps with bacteria and viruses and all that thanks to the xylitol. So it helps kind of keep their nose extra clean.
I love that. And do you suggest morning, night, once a day? What's the routine for that?
Our protocol is nighttime. So before bed, before they put their tooth pillow in, they'll spray their nose a couple of times, blow their nose really good, and then put their tooth pillow in. Yeah. But it's actually, I mean, it's so safe. You could use it every hour if you were having like terrible nasal breathing that day in your baby. So,
Okay. I love that. Dr.
hey.
Kalli, you are so incredible. Where can our audience come connect with you, learn more about Toothpillow, learn more about getting a consultation?
Yeah, so you can go to toothpillow.com and you've already said amazingly that our Instagram is toothpillow_official. And my personal Instagram is the airway-centered dentist, all spelled out.
I love it. Oh my gosh. Well, thank you for the work you're doing for our babies and just for Toothpillow in general. I know that this is going to impact a lot of mamas. So thanks for being on the show.
I appreciate it so much. I hope to chat with you again soon.
Thanks so much for tuning into this episode. If you love this episode, make sure that you subscribe and give a 5-star review. This helps get our message out to more people. And if I'm honest, I think this is probably one of the most important episodes that I've done or interviews that I've done. I personally have seen how this topic of airway health can actually impact you personally, myself, as well as in your own family. And I just find that this information is so scarce. It's so hard to find legitimate information around mouth breathing and all of these things that Dr. Hale talked about. So if you know a mama who has a little who might be struggling with any of the things that she talked about, or if this is something that resonates with you personally, please let us know. You can always screenshot and share on Instagram and tag us. I love to see what you think about our episodes. Until next time, we'll see you then.